You know, you've got asthma, you've got eczema.
I knew about meningitis, I knew about cot death.
You're aware of all these other childhood, illnesses, but no mention of type 1 diabetes.
I think the main problem with GPs and primary care is we are so focused on type 2 diabetes. It's our bread and butter. 95% of our diabetic patients we see on a day-to-day basis are going to be type 2. And the important thing about type 1 diabetes, there often isn't a family history to go by.
He was 3.5. I'd taken him to the doctors because he'd started off with a temperature and just generally not right. He was drinking excessive beakers of water. We thought, oh, it's a bit hot, so maybe it's the weather. And then one night he was in the bathroom drinking from the tap. The week before, I'd put him in a new outfit and his little shorts fell down, even with the adjustable waistband in it. And that's when I realised he'd lost weight as well.
The huge problem we have when we see children, we often think about other things, not necessarily type 1 diabetes.
I took him to the GP and took a urine sample, and they said, oh, it's more likely a water infection. We'll put him on antibiotics. I mean, I mentioned the excessive thirst and bedwetting.
Kate's son Louis had the 4 key symptoms of type 1 diabetes, the 4 T's. He was tired, thirsty, thin, and weeing a lot. Sometimes children might have only 1 or 2, so it's important to ask parents whether any of the 4 T's are present in their child.
We went to the doctors and was told to bring him back in 10 days for a blood test. The next morning, he woke up and he could hardly breathe. He could hardly stand up. So I phoned the doctors.
If you see a child presenting who is unwell, think glucose. And if you think glucose, you need to be doing blood glucose testing. Don't wait for a hospital test.
Waiting can have fatal consequences. A severe lack of insulin means that the body can't use glucose for energy, so it breaks down other body tissue instead. The byproduct is a range of poisonous chemicals which, left unchecked, are life-threatening. Around 1 in 5 children have diabetic ketoacidosis by the time they are diagnosed with type 1 diabetes.
We were the worst case scenario. I took him thinking, yeah, he's not very well. He's got a cough, a cold, flu, virus, some sort of infection. You know, it was between Christmas and New Year's. Everybody's not very well at that time. There's lots going round.
A lot of these children arrive pre-DKA, where they just come across as maybe a bit poorly, maybe a bit increased thirst, and it's very easy to put that down to a chest infection or a sore throat.
On New Year's Day, I phoned an ambulance at 4 o'clock in the afternoon, and within 10 minutes the paramedic had arrived. The very first thing they did after giving him oxygen was prick his finger, and within 30 seconds I was told he was a type 1 diabetic. But of course it didn't end up. The result was not Peter leaving hospital as type 1 diabetes' newest ambassador. It was Peter leaving to go to heaven. And that's now what we have to live with, and you know, it doesn't need to happen today. It just doesn't need to happen. We have the technology. It's a finger prick test. It's not an MRI scan, you know. Every GP can do it instantly. It takes seconds, results in seconds, and you can get help straight away.
The simple message to go home with is, if you see a sick child, think glucose. If you think that this child should have blood glucose testing, do a finger prick test. If the test is positive, admit as an urgent admission.
That will live with me forever, that it's somehow I missed it. And I couldn't have stopped him getting type 1 diabetes, but I could have stopped him getting DKA. And it was DKA that nearly killed him.
We just don't want it to happen to anybody else, ever again. And we know that by pricking kids' fingers when they go to the GPs with common ailments, that can save lives, you know, can save lives.